If you have prominent darkening of the forehead in the center or on the sides, then this video is for you. In this video, I'll tell you what are the causes for darkening of forehead, what are the treatments that you can do, and how we can prevent it. So let's get started. So what are the causes for dark forehead? If it is slowly developing, then it could be due to friction. Friction due to rubbing this area or wearing any kind of caps that can cause friction in this area, using scrubs. This can lead to darkening of the forehead. It could also be due to melasma. Sometimes melasma can occur only on the forehead, especially just above your eyebrows. So if there is darkening in this area, then we have to rule out melasma. Third is acanthosis nigricans. If there is darkening along with slight thickening of the skin in the area, then we have to rule out acanthosis nigricans. Acanthosis nigricans is a condition of insulin resistance where there is increased amount of insulin in the body, which leads to thickening of the skin, leading to darkening. This can be seen on the forehead, on the sides of the neck, in the underarms area, in the groin, under the breast. It can also be sometimes seen on the around the mouth. Okay, so acanthosis nigricans has to be ruled out in all people who are overweight or have a family history of diabetes. Fourth is macular amyloidosis. This is also one of the common causes for darkening of the forehead. Macular amyloidosis is a very difficult condition to treat. It occurs when the amyloid is deposited in the upper layer of the dermis. So skin has two layers, the epidermis and the dermis, and this amyloid gets deposited just below the epidermis in the upper dermis. Okay, so that is when you get this kind of darkening. Macular amyloidosis occurs on the upper back, the arms, legs, and can also occur on the sides of forehead. It gets exacerbated on scratching the area, but we don't really know the exact cause for macular amyloidosis. That is also the reasons why we don't have effective treatment against it. Now, if there is sudden darkening, what can be the causes? First is post-inflammatory hyperpigmentation. So any kind of injury that can occur on the skin can heal with dark spots. This could be due to allergic contact dermatitis, to hair dye, forehead, behind the ears in this area, or the nape of the neck. Then we have to rule out allergy to hair dye. It could also be due to any kind of contact allergy to hair oils. Hair oil, especially if you add any kind of menthol or peppermint in it, that can also lead to irritation to the scalp. This can then heal with darkening. Darkening of the forehead can also be due to tanning. If there is excessive sun exposure, then because of the curvatures of the forehead, it makes it more prone to develop darkening. So whenever you are tanned, you feel that your forehead and the nose gets very prominently darker as compared to the rest of the face. So this is also one of the reasons for darkening of the forehead. It can also be drug induced. If you've taken any tetracyclines or anti-malarial, that can also lead to darkening of the forehead. So whenever we are faced with dark forehead, we need to know whether it's a sudden onset or it is slowly progressive in order to find the cause. Because finding the cause is very important in order to address it and improve the condition. So how do we prevent darkening of forehead? Genetic conditions like macular amyloidosis are difficult to prevent completely, but there are certain things you can do so that the forehead doesn't get darker. First is to use a sunscreen. Sunscreens help in protecting the skin against UV rays, and whenever there is sun exposure, whatever the reason for dark spots is, that tends to get worse. So if you are somebody who has a habit of using sunscreen on a regular basis, then you are keeping all types of dark spots at bay. Okay, so using a sunscreen regularly is important. Avoid wearing very tight caps for a long time. This can also cause a lot of friction to the forehead area and lead to darkening. If you must wear helmet, make sure that it's properly cushioned and that you have moisturized the skin before wearing the helmet so that the amount of friction that is between the helmet and the forehead is lessened. If you have acanthosis nigricans, that is darkening of the other body folds, then you have to focus on losing weight. Losing weight, avoiding sugar and exercising regularly can markedly improve acanthosis nigricans. So if you just make these lifestyle changes, you will notice an improvement in darkening of all the body folds as well as darkening of the forehead. Another thing to remember is to treat it early. This is not a prevention, but as soon as you notice spots on the forehead, please seek medical attention and treat it, because when it is long standing, dark and extensive, then it becomes very difficult to treat. So what are the things we need to avoid? If you have darkening of the forehead, avoid any kind of scrubs. Any kind of physical scrub should not be used because this will only cause more irritation to the skin and cause further darkening. Avoid wearing very tight headbands. that can also lead to darkening in this area. Avoid rubbing your face with thick towels, especially if you are somebody who works out, especially if you work out in the gym. This motion of trying to wipe your sweat against your sweatband or using thick towel to rub your face, that can also lead to darkening. So be gentle, just dab the sweat rather than rubbing the forehead off. Avoid irritating home remedies. This is one point I tell you for all kind of dark spots, because using these home remedies can be completely counterproductive. It can actually irritate the skin and make dark spots worse. So stay away from it. So how to treat darkening of forehead? First is to find the cause and try to address it. Like I said before, if it's acanthosis nigricans, losing weight can help. If it is darkening due to hair dye, then avoiding hair dye use can help. You can avoid dyes with PPD in it and go for other alternatives that can also help in improving the darkening. I have recommendations for PPD-free hair dyes in the description box below. If you have darkening of the forehead, then I suggest you to avoid using hair oil. Using mustard oil on the hair can lead to darkening of the forehead, because mustard oil combined with sun exposure does tend to irritate the skin and lead to darkening. So if you have darkening of the forehead, I would suggest you to avoid hair oil completely. It's better to instead use like a hair serum if you want to style your hair, and always use a moisturizer and sunscreen on the face. So what are the treatments available? Treatments can be divided into two parts: what you can do at home and what you can do in the clinic. So at home, you can use agents which help in reducing melanin production and reducing dark spots. So you can look for ingredients like kojic acid, alpha-arbutin, niacinamide, licorice extract, and glycolic acid. This helps in reducing the dark spots. The creams have to be used twice in a day along with sunscreen. Sunscreen application is very important. Unless you apply sunscreen on a regular basis and practice shade-seeking behavior, you're not going to see any improvement in your dark zone. Remember that if the darkening is very, very deep and extensive, then just using creams will not improve. Then we'll have to go for in-clinic procedures that I'm going to tell you now. So in clinic, we can go for chemical peels that can help in shedding the upper layer of the skin and help in better penetration of the creams that you're going to use, and also get rid of the darkened upper layer. And this exposes a lighter colored lower layer, which helps in improving the appearance of dark forehead. You can also go for Q-switched Nd:YAG laser. This breaks the melanin pigment into small fragments, and then our body cells remove this pigment. So this helps in lightening dark spots, especially when they are deep. You can also go for fractional CO2 laser sessions, especially if the texture in that area is different, if it is thickened or there are scars, or you want to improve the overall quality of the skin. Then fractional CO2 laser helps in getting rid of the dark patches as well as improves the quality of skin. So a few sessions done judiciously in low heat settings can help in improving the darkness on the forehead. Another treatment that can help is skin boosting injections. This can be combined with all the treatments that I've mentioned before. In skin boosting injections, we deposit small aliquots of hyaluronic acid under the skin. This tends to attract water and helps in reducing the appearance of darkening of the forehead. This will also improve the capability of the skin to take on treatments, and also hastens the recovery process or the healing process. So it's a good treatment to take if you struggle with darkening of the forehead. So there you go, a detailed video on dark forehead. We must find the cause. Only then can we be able to treat it effectively. There is no one cream or a single cream or treatment that will get rid of all types of dark forehead. Finding the cause and trying to address it, along with treatments which are like creams at home and sunscreen, along with in-clinic procedures, is what helps in reducing the darkening of the forehead. I hope you found this video useful. If you like such skin and hair related content, you can follow me on my Instagram handle Dr. Aanchal MD, where I post such skin and hair related content daily. Thank you for watching.